I started medicine when there was no Medicare and no Medicaid, and let me tell you, I don't remember one time where I saw people out in the streets begging for medical care. Now we do. With managed care and now with socialized medicine coming, believe me, quality will go down, costs will go up, there will be shortages, there will be lines, and nobody's going to be happy.
I don't know exactly the countries. I think if you talk to people in the countries that have those systems, they'd think their health care is pretty good.
Would you know specifically though, or Canada, Britain?
Canada, Britain, maybe France. I don't know the exact countries, but again, I don't think the president's going way out on a limb that some people in other countries have a health care system that they like, just as Americans like the health care system that they have.
My sister explains when you say they both had shoulder injuries, you go to the doctor, they say take some painkillers and wait. So they don't even provide any physiotherapy or anything, just go away and wait. So eventually it's like it's not better, mum's not better, they're put on the waiting list for physiotherapy. That can be months, 6 months easily. And the girl at work, she's got an ankle problem, so she's been to a doctor, but nothing's been done there. And then she's had to wait 9 months for an appointment with the National Health Service for a physiotherapist to look at her ankle. Then there's a huge bit of physiotherapy under the National Health Service. You get about 6 weeks, and that doesn't seem to be as strong as other aspects of it. And if that doesn't work again, you then need to wait for a referral to a surgeon, which could be more months. It was in my husband's case. My sister hopped out because she was privately insured, and then they see you, they might agree you need an operation, say, and then you've got a waiting list for the operation.
How long are waiting lists for an operation?
Well, each stage has a waiting list, so I think my ex-husband must wait 1.5 years for a shoulder operation.
Was he in pain during the year?
Yes. Yes.
So for 1.5 years he was in pain?
He was in pain, he couldn't work properly, and probably, you know, in some cases the conditions worsened.
If you look at the fights going on in Britain with the National Health Service, it is amazing how politicized they are and how little they have to do with best care, best standards, whether it's the right approach for breast cancer or the right kind of prescription drugs or a whole range of issues.
It's been in the press a lot. There's certain cancer-treating drugs that were denied people because they weren't approved by, I can't remember the authority, because they were considered too expensive, and there was a whole load of kerfuffle about, well, can I just pay for my top-up drugs? And they were told, no, you can't. If you just pay for your top-up drugs, you'll have to pay for all your private treatment. They're ordinary people that had the money for their top-up drugs.
So a lot of cancer patients were told that if they wanted to purchase privately, they had to go
then pay for the whole. Yes, exactly. Yes, that was the case.
So they couldn't mix.
No.
What would they do if they couldn't get it?
Die. Or die sooner. Well, they can't afford the private treatment, so in their view, they were going to die sooner.
This country with private enterprise changed the world. Why on God's green earth do we want to go and adopt a healthcare system that isn't working in the rest of the world? I mean, unless you listen to Michael Moore and you want to get your healthcare in Cuba, which he tells me is great.
Can we, in fact, develop a health system which is a health-based health reform, working on best standards and best procedures, modernizing the system, saving enormous amounts of money, which would allow us to fundamentally change the system? And can we do it without going to a British-style national health system, without going to a system which blocks Americans from getting best practices and which turns power over to a Washington-based bureaucrat to decide whether or not we live?
We've had corporate medicine now for about 30 years, which is managed medicine by the government, and it's been a total disaster. And it didn't do much more than push the costs up. And it didn't work, so now we only have one other choice, it seems, and that is going toward total government medicine. I would like to see that medicine be delivered in the marketplace like other goods and services. There's no reason we can't do this. Everybody complains about one thing. The cost of medicine is too high, and it is. But they never talk about exactly why. There's an inflation factor involved, too. I mean, we create inflation, but it goes into certain areas of the economy more so than others. The more the government is involved in an industry or a service, the higher the prices go. So in education, cost goes up way beyond the cost of living, and the cost of medicine goes way up. So you can't solve the problem of medical care by ignoring this. Now, Obama says what we're going to do is we're going to tremendously increase the services, and we're going to cut all the payments to the doctors and the hospitals.
All right, well,
I mean, where's he coming from? That can't possibly work.
There's a lot of problems with doctor-patient relationship nowadays, as I said, because of the intrusion of the insurance industry, first and foremost, where I will recommend a certain test and they may not authorize it, or I'll prescribe a certain medication and it's not within their formulary. Look, I'm in favor of cost-efficient healthcare, and I think I provide highly cost-efficient healthcare. But if I think a certain medicine is the right medication for a patient to use, it shouldn't be a bureaucrat, perhaps a kid on the other side with no advanced health training, determining whether that should be covered or not.
We've had managed care now for about 35 years. It's not working, and nobody's happy with it. The doctors aren't happy, the patients aren't happy. Nobody seems to be happy except the corporations, the drug companies, the HMOs. You take care of poor people by turning the medical care back into the system where people have some choices. You cannot expect socialized medicine of the Hillary brand to work, and you can't expect the managed care system that we have today, which promotes and benefits and rewards the corporations, because it's the drug companies and the HMOs and even the AMA that comes to us and lobbies us for this managed care, and that's why the prices are high. It's only in medicine where technology has raised prices rather than lowering prices.
We have perfected a system of terrific healthcare in this country because of competition, because of scientific research. But what we have not is had the proper competition, actually, I would argue, in the area of insurance healthcare. The healthcare industry has become overly strengthened, and they have therefore really not been competing well, and they kind of own the ticket, so that patients who have healthcare coverage with insurance companies often don't get health care if it's not covered by the insurance company. That's the wrong model. People should be working doctor-patient directly, get the health care they need, and the coverage should be in the background, where it has been twisted to become in between the doctor-patient relationship. That's just wrong.
The other thing that we have all messed up is the concept of insurance. We're talking, what is assumed is insurance is prepaid services. Insurances are supposed to measure risk. But now when you talk about health insurance, that means pay for everything. But we need some market factors. We need control by the patient. We need an incentive not to waste our services. We need some tax incentives, and we need the control back in the hands of the patient.
Some of the managed care models, the HMOs as we call them, have sometimes based upon, for example, over my years of practice, there's been zero copays in some healthcare systems, insurance. And if you have no copay, you might be more apt to come in when you don't need to be seen, as opposed to someone with a $40 copay who might think twice about it. I don't think it's talking in a realistic way that Americans should have the right to go anywhere they want, for any care they want, currently, because the system doesn't permit that. It's expensive to do that. And that's one of the reasons we have a system right now. It is by far the best healthcare in the world in America. But the healthcare system of provision of healthcare is fragmented and broken and not working properly.
I was in medicine before government was involved, and there were a lot of poor people. There was no government insurance, but everybody got taken care of. And then nobody was charged. But now today they come in and everybody's charged the maximum amount of money, or they're put on to the rolls. The government will pay it, put them on Medicaid, and jack the bill up. I mean, the attitudes are completely different.